Waking up with stiff, aching joints after 50? You're not alone, and you're definitely not imagining it. Millions of people over 50 silently battle joint pain, arthritis, and morning stiffness. Most rely on painkillers to get through the day, but those same medications can slowly damage your liver, gut, and even your heart. But what if the real solution isn't in another pill, but in nature? In this video, you'll discover 3 science-backed natural supplements that don't just mask the pain, they actually fight the root cause, inflammation and cartilage breakdown. Here's what we'll uncover: the top 3 joint supplements that actually work, with real clinical results. How to take them for maximum effect. Who should avoid them? And the number 1 mistake most people make when buying supplements, costing them their health and their money. Let's jump right in. Number 1, Boswellia serrata, the inflammation blocker. If you've never heard of Boswellia serrata, it's time you did. This ancient Ayurvedic remedy, also called Indian frankincense, has stood the test of time for over 3,000 years. And now, modern science confirms what traditional medicine knew all along. So, what makes Boswellia special? It's all about boswellic acids, particularly a compound called AKBA, which blocks a major inflammatory enzyme in the body called 5-lipoxygenase. Unlike NSAIDs, which often wreck your stomach or increase heart risks, Boswellia reduces inflammation without those dangerous side effects. A 2020 meta-analysis in Phytomedicine found Boswellia significantly reduced knee pain, stiffness, and improved mobility, with some people reporting up to 68% pain reduction in just 8 weeks. And the best part? It's gentle on your body, no ulcers, no stomach upset, no increased heart risk. Recommended dosage: 100 to 250 milligrams per day of a standardized extract, with at least 65% boswellic acids, preferably enriched with AKBA. Take it with breakfast for better absorption. Caution: if you're on blood thinners or NSAIDs, talk to your doctor before starting. Number 2, curcumin, nature's NSAID without side effects. If inflammation is the fire behind arthritis, curcumin is the extinguisher. Found in turmeric, curcumin is a powerful anti-inflammatory that blocks the same enzymes and pathways as common painkillers like ibuprofen, without the nasty side effects. A 2021 meta-analysis in the Journal of Medicinal Food found that curcumin significantly improved pain, stiffness, and function in people with osteoarthritis. One study even compared curcumin head-to-head with ibuprofen, and the results? Both reduced pain, but curcumin had fewer side effects and better gut tolerance. But here's the catch: curcumin alone isn't absorbed well. To unlock its full potential, choose a supplement that contains black pepper extract, piperine, or better yet, one that uses liposomal or nanoparticle delivery to boost absorption up to 20x. Recommended dosage: 500 to 1,000 milligrams per day of standardized curcumin extract, with food. Best split into 2 doses. Avoid high doses if you have gallbladder issues, are on blood thinners, or have bleeding disorders. Remember, turmeric powder in food is not enough. If you want real joint relief, you need clinically dosed curcumin with enhanced absorption. Number 3, glucosamine plus chondroitin, the joint builders. Now let's talk about the 2 most researched joint supplements on the planet. As we age, the cartilage in our joints wears down, especially in the knees, hips, and spine. That grinding pain? It's often due to thinning cartilage and lost joint cushioning. That's where glucosamine and chondroitin come in. Glucosamine helps rebuild cartilage. Chondroitin helps it retain water and remain elastic, like a sponge inside your joint. A 2018 Lancet review of dozens of clinical trials found that this combo reduced joint pain and improved movement, especially with consistent use. Another large-scale study with over 1,600 people found that taking both together was far more effective than taking either one alone. That's because they work synergistically, helping repair and protect your joints long-term. Recommended dosage: glucosamine sulfate, 1,500 mg per day. Chondroitin sulfate, 800 to 1,200 mg/day. Stick to glucosamine sulfate, not hydrochloride. Sulfate is better absorbed and better studied. And be patient, it can take 6 to 8 weeks to feel the full benefits, but the long-term results are worth it. Safety tips: who should be careful? These supplements are natural, but that doesn't mean they're risk-free. Here's what to watch out for. Boswellia may interact with blood thinners or NSAIDs. If you're on warfarin, aspirin, or similar meds, consult your doctor. Curcumin, avoid if you have gallstones or bile duct issues. It can also thin the blood, so don't mix with anticoagulants unless supervised. Glucosamine/chondroitin, often derived from shellfish, avoid if you're allergic. Also, glucosamine may affect blood sugar, so diabetics should use it cautiously. When in doubt, talk to your doctor first. Avoid this common mistake. Before you buy anything, here's what most people get wrong. They choose the wrong brand. Many joint supplements are filled with fillers, underdosed ingredients, or unproven proprietary blends. In fact, studies show that over 1 in 5 supplements don't contain what they claim, and some even contain contaminants or banned substances. What to look for instead: third-party tested products, NSF, USP, informed choice, no proprietary blends. Transparent labeling with clinically backed doses. If you're investing in your health, make sure it's the real deal. You don't have to live in pain. These 3 natural supplements, Boswellia, curcumin, and glucosamine plus chondroitin, have the power to reduce inflammation, repair joints, and restore movement safely and naturally. They won't work overnight. But if you stay consistent, they may just change your life. Start small. Track your progress. And most importantly, stay informed. Have you tried any of these supplements before? What worked for you, and what didn't? Drop your story in the comments. Your experience could help someone else. Like this video if you found it helpful, subscribe for more real, research-backed health advice, and share this with someone you care about, someone who deserves to wake up pain-free again.